I'm Dr. Hirday Kapoor from Cloudnine Hospital, Punjabi, Bagh. Today we are talking about preparation for delivery. The preparation for delivery starts from the day the woman conceives. The first question that is asked by the relatives, especially the mother-in-law, इसकी तो normal delivery हो जाएगी ना डॉक्टर साहब? So to have a normal delivery, what we have to do is take a good diet, do exercises, but exercises only if there are no contraindications to exercises, like the placenta should be lying in its proper place, it should not be a low-lying placenta, and the presentation of the baby should be cephalic. With cephalic means with the head down and feet up. Now, if there are no contraindications to exercise, the lady should at least do 30 minutes of brisk walk and should do certain yoga poses, which are like mountain pose, cat pose, and she should also do some breathing exercises and butterfly exercises, which will help her in opening out the pelvis, relaxing the pelvic muscles, and having a normal delivery. But once you reach around 35 weeks and you have your third trimester scan done, which shows that the blood flow towards the baby is normal, everything is fine, there is no cord around the neck, and the presentation is cephalic, then it is a time when the lady should start preparing and start doing more vigorous exercises like squatting exercises, so that even the further the pelvic muscles relax and the head starts engaging and going down. Once she is 35 weeks plus, maybe 36 weeks plus, जिसे कहते हैं कि 9वां लगने के बाद कभी भी डिलीवरी हो सकती है, that is the time when these things should be done. That is, when you pack your bags, keep the baby clothes ready, keep your reports and everything ready, look out for any infection, that there should not be any infection, keep your hygiene up to date, keep yourself clean, eat a good diet, do not insist and do not take too much of oil or butter or ghee as recommended, because this was done in the earlier ages when there used to be no enema. Since now enema is present and there is no need to take so much of ghee intake, because that will only bring about increase in the blood pressure and may cause some enzymes to be elevated in the liver and cause problems for a normal delivery. And the lady should exercise and do a deep breathing exercises. When to reach the hospital? Once you start having labor pains, that is, the pains which start from the back, come to the front, which are consistent, and with time the frequency keeps on increasing and the duration keeps on increasing. Secondly, in case there is a water leakage which you cannot control and your panties are getting wet, you're not able to control that even willingly also, so that is the time when you realize the water around the baby has started leaking out, and that is time to reach the hospital. And last but not the least, in case if there is something known as show is like on the second day of the period, if you have a somewhat mucus bloody discharge, that is the time when the mouth of the uterus is opening up, and that is the time when you should reach the hospital. Once the hospital you have reached, the junior doctor will examine you and will see how many times you're having the contractions, whether the contractions are consistent, and she will do a gentle examination on you and accordingly inform the doctor, and you will be taken to the labor room for the needful.